Mm. Okay, hello, Pharm scholars. This is the conclusion of chapter 45. We're talking about drugs used to treat infections. We left off on slide 22. We were going to start with the drug class penicillins. So with penicillins, the action is they inhibit cell wall synthesis. They are used to treat middle ear infections, pneumonia, meningitis, urinary tract infections, syphilis, and gonorrhea. Common adverse effects with penicillins is diarrhea and electrolyte imbalance. Serious adverse effects is hepatotoxicity, nephrotoxicity, hyperkalemia, and hypernatremia. For specific drugs in this class, please see table 45.6. And they may interfere, penicillins may interfere with contraceptive activity of oral contraceptives. So counsel your patient when you're doing patient teaching to use additional protection methods, okay? I'm going to say it again. So penicillins may interfere with contraceptive activity of oral contraceptives. Counsel your patient to use additional protection methods, okay? So some condoms or whatever that thing is. Let me see. I'm going to move on to slide 23. So the next class that's on the PowerPoint is quinolones. These drugs are, the action of them, the subclass known as, oh my goodness, what is this blocking my... I can't see. Yeah, I don't know. Something got typed in over there. I'm going to try to fix it. But the action of the quinolones is they inhibit activity of DNA gyrase, an enzyme needed for replication of bacteria. They're used they're effective against gram-positive and gram-negative bacteria. Common adverse effects with these are nausea and vomiting, diarrhea, discomfort, dizziness, and lightheadedness. Serious adverse effects is photosensitivity, rash, nephrotoxicity, neurological effects, and hepatotoxicity. For specific drugs in this class, please reference table 47.5. Okay? And it said that this is a subclass known as, I'm finna just see something. Hold on a second. I don't know what got in the way of my wording and I can't really see what that is. I'm gonna try to fix that later just for the sake of time. Okay, so we're still talking about, I'm moving on to slide 24. So we're still talking about quinolones. They should not be prescribed for patients younger than 18 years of age, or patients that have resulted in increased incident of muscular skeletal disorders. So should not be prescribed for patients younger than 18 years old, or if they've had result in an increased incident of muscular skeletal disorders. Risk of musculoskeletal disorders in patients older than 60 is increased in patients using corticosteroids. So what that's saying is if a patient is prescribed a quinolone and they're older than 60 and they're also using corticosteroids, they are at high risk for having musculoskeletal disorders, okay? Animal studies have demonstrated terogenic effects. That means that it can cause birth defects in pregnancy. And levofloxacin is used with caution in older patients with long QT syndromes, that's dealing with heart stuff, hypokalemia, or taking certain antiarrhythmic medications, okay? I am moving on to slide number 25. We're going to move on to our streptogramins. These particular meds, the action, they inhibit protein synthesis in bacterial cells. They are used to treat vancomycin resistant E. faecium, or VRE, and MRSA. So they're used to treat VRE and MRSA. Common adverse effects is pain, infusion site inflammation, nausea, vomiting, anorexia, abdominal cramps, diarrhea. Serious adverse effects is hepatotoxicity, arthalgia, myalgia, numerous serious drug interactions. So you want to know what those drug interactions are. They are important for treatment of vancomycin-resistant bacteria, and they are reserved for cases in which other antibiotics are not effective. Okay? I'm going to move on to slide number 26. So, this drug class is our sulfonamides. They inhibit bacterial biosynthesis of folic acid, resulting in cell death. They are used to treat UTIs, otitis media, which is a ear disorder infection, traveler's diarrhea, chronic diarrhea, and is used for prevention and treatment of pneumocystic jirovecii in immunocompromised patients. Common adverse effects: nausea, vomiting, anorexia, diarrhea. Almost all your sulfonamides are going to start with sulfur. So when your patient is prescribed these particular medications, please just make sure you assess the patient for allergies. Make sure that a patient does not have a sulfur allergy, because if they have a sulfur allergy, they're going to have some kind of reaction if they're allergic to it. Because sulfonamides work fast, usually after 1 or 2 doses. They're often used prophylactically in patients susceptible to a strep infection or rheumatoid fever when penicillin is contraindicated. So let me say that again. Sulfonamides are used prophylactically in patients that are susceptible to streptococcal infection or rheumatic fever when penicillin is contraindicated. I would star that. They're used prophylactically in patients susceptible to streptococcal infection or rheumatic fever when penicillin is contraindicated. Okay? I am going to move on to slide number 27. Oh, I'm sorry. So your specific drugs for these are in table 45.8. So please take a look at those and get familiar with those meds. So I'm moving on to slide 27, and I'm still talking about sulfonamides, right? So the serious adverse effect with these are rash, pruritus, which is itchy skin, photosensitivity, hematologic reactions. So they can have reactions going on with their blood work, neurologic CNS effects. Instruct your patient to notify the prescriber if rash or pruritus develops. Crystal formation in urinary tract if patient is dehydrated. So what that means is, if a patient is not staying hydrated with these crystals form in the urinary tract. They may or may not lead to some type of kidney stones. This is where it's imperative where you learn what you need to teach your patients when you're doing patient education. So on this particular med, you want to encourage your patients to drink lots of fluids, because we don't want these crystal formations to form that may possibly cause some type of kidney stones, okay? So please go back on, again, that's on table 45.8. Go back and look at those particular drugs in that class. I am moving on to slide number 28. Slide 28, drug class is tetracyclines. Oh, excuse me. The action of these meds are they inhibit protein synthesis by bacterial cells. They are used to treat STIs or STDs, UTIs, urinary tract infections, upper respiratory tract infections, pneumonia, meningitis when penicillin is contraindicated. Common adverse effects with these, again, your NV, nausea and vomiting, anorexia, abdominal cramps, and diarrhea. Serious adverse effects is photosensitivity. For these specific drugs, please see table 45.9. Here we go back to patient education. These particular meds can stain the teeth, and they're not recommended for children younger than 8 years or pregnant women. So when your doctor is prescribing these things, and most physicians should know this thing, but again, everybody gets busy, and just in hindsight, oh, she got this, let me write the script. You got to know what's going on with your patient, and you got to know what these drugs do, what's going on with your patient allergy-wise, how old are they? You want to teach them that this medication can stain the teeth, because they probably going to wake up, and if their teeth is not what they supposed to look like, they probably going to freak out. So you want to educate your patient that they stain the teeth. They're not recommended for children younger than 8 years old or for pregnant women, okay? Slide number 29 is a question. You are welcome to answer that and bring that. We can discuss that next week if you like. And now I'm going to move on to slide number 30. And we now move into what we call our anti-tubular tubercular agents. So, tuberculosis. Now we're going to talk about the meds that are which work or help cure the tuberculosis, right? So the drugs in this class, what they do is they alter cellular RNA synthesis and phosphate metabolism. They are used to treat tuberculosis. Common adverse effects: nausea, vomiting, anorexia, abdominal cramps. Severe adverse effects: confusion, hallucinations, blurred vision, red-green vision changes. That's huge. If your patient is having red-green vision changes, blurred vision, all these serious adverse effects are serious, and you want to instruct your patients to contact the healthcare provider if this is happening. There are three ethambutol, isoniazid, and rifamycin. Y'all bear with me, because all these things is driving me nuts. But ethambutol, isoniazid, and rifampicin must be used in combination to prevent resistant organisms. Major problems with toxicity can occur. Treatment can last up to 6 months. Tuberculosis is a very slow treating bacteria, bacilli. It takes a long time to treat this, to kill this bug off. So treatment is really lasts about 6 months for anti-tubular agents. So I'm moving on to slide 31. They're talking about INH. That's the short for isoniazid. They disrupt the cell wall and inhibit replication of tuberculosis bacteria. It's used to treat and prevent tuberculosis. Common adverse effects: nausea, vomiting. Serious adverse effects is hepatotoxicity, tingling, numbness of hands and feet, dizziness, and ataxia. Adverse effects are dose-related. So concurrent use of pyridoxine usually prevents the symptoms. So again, make sure you look over your anti-tubular agents. Another one is tebrazid. These lower the pH of the environment. They're used to treat tuberculosis, often in combination with other anti-tubercular agents. Common adverse effects: nausea, vomiting, anorexia, and arthralgia. Serious adverse effect is hepatotoxicity. This particular medication is contraindicated if a patient has gout. So again, this tebrazid is contraindicated if patients have gout. Okay. So another anti-tubular tubercular agent, I'm moving on to slide 31, is rifidin. The action they prevent RNA synthesis by inhibiting DNA-dependent RNA polymerase. They are used to eliminate meningococci and H. influenzae B-type HIB from asymptomatic carriers. Common adverse effects is a reddish-orange secretions. That's huge because you want to tell your patients your pee may be red or orangish color. Excuse me. Serious adverse effects is nausea, vomiting, anorexia, and abdominal cramps. This particular medication can also be used in combination with other agents to treat tuberculosis. Okay? I am moving on to slide 34. I'm sorry, 32. Am I on 32 or 30? Oh, okay, 34. So now I'm on actually slide 30. Okay, slide 34 is a question. Now I'm going to move on to slide 35. So, on slide 35, they talk about miscellaneous antibiotics. You can see them listed here on the slide. So the ones that's listed here, they're saying the serious adverse effects again is diarrhea, muscle pain. Be familiar with the miscellaneous antibiotics in regard to treating infections. I didn't write the table down, so I'm assuming that it's in this chapter. It's probably following along in order the way that I've been rolling them out. I'm going to go on and move to slide number 36. They continue to talk about miscellaneous antibiotics. Flagyl works for things that are more bacterial. Your trichomonocidal and protozoal also fall in this category. And this Tindamax, they're similar to metronidazole. The primary outcome with these is elimination of the parasitic infection. And make sure you look over that section of miscellaneous antibiotics in this chapter. I am moving on to slide 37. It is a question. And now I'm going to jump onto slide 38. And on slide 38, we are getting ready to talk about topical antifungal agents. So, topical antifungal agents. So, the action of these meds alter permeability of cell membranes, causing amino acid and electrolytes to leak out. They are used to treat tinea pedis, that's like athlete's foot, tennis cruis, tennis corpius, tennis vesicular, and candida infections. Common and serious adverse effects is irritation, redness, swelling, blistering, and oozing. Excuse me. See specific application information. What I mean by that is often, no matter where you work, all these ointments and creams and stuff will come in the box that they're prescribed in, and they'll have inserts with information if you need to review or go over anything that you need to let your patient know. Now, for these specific drugs, please see table 4510. Watch for secondary skin rashes. So you want to educate your patients to make sure that they're watching for secondary skin rashes. Okay? Moving on to slide number 39. This drug class is systemic antifungal agents. Drug is this amphotericin B. Action is it's a fungal agent, and it disrupts the cell membrane of fungal cells. It's used to treat of systemic life-threatening fungal infections. So it's used to treat systemic life-threatening fungal infections. Common adverse effects: malaise, fever, chills, headache, nausea, vomiting, and thrombophlebitis. Your serious adverse effects is nephrotoxicity and electrolyte imbalance. And that's pretty much These meds should not be used for non-invasive fungal infections such as thrush, vaginal candidus, and esophageal candidus. They should not be used for non-invasive fungal infections. These are used to treat more systemic. Systemic means the infection is now spreading throughout the body, right? These are used to treat more systemic, life-threatening fungal infections, okay? So we're still talking about systemic antifungal agents. I am now on slide 40. So you have diflucan. The action of these, they're chemically related to the ketoconazoles and itraconazoles. They inhibit certain metabolic pathways in fungi. They are used to treat meningitis, candidus, and systemic candidus. Again, your common adverse effects: NV, nausea and vomiting, and diarrhea. Serious adverse effects is rash and hepatotoxicity. And these are usually administered via IV and oral routes. Okay? We are still talking about systemic antifungal agents. I am now on slide 41. Okay, so the drugs in this class, they stop cell division and new cell growth. These particular medications are used to treat ringworm. Common adverse effects, again, NV, nausea and vomiting, and abdominal cramps. Serious adverse effects is urticaria, rash, pruritus, photosensitivity, confusion, dizziness, secondary infection. So these can cause another infection. We're trying to treat one problem and create another one, right? Nephrotoxicity, hepatotoxicity, and hematologic. I don't know if I was supposed to have something else there. It don't seem like that was finished. These are oral medications only. Their treatment often required for several months. Ringworm is another one of those that is a very slow healing fungi. It is a very slow healing, and most likely patients, whatever the treatment is for ringworm, is really slow. So they probably are going to be whatever they're going to be on for months, okay? That's something you want to tell your patient, because we want our patients to be compliant in order for the problem to go away, right? So I am moving on to slide 42. We're still talking about systemic antifungal agents. The sporanox, they are chemically related to fluconazole and ketoconazole. They interfere with cell wall synthesis. These meds are used to treat a variety of infections such as candidus, histoplasmosis, blastomycosis. Common adverse effects is nausea and vomiting. Serious adverse effects is hepatotoxicity, heart failure, pruritus, rash, and there's numerous serious drug interactions. So become familiar with those, or at least look at those and go over those. We do not administer to patients with a history of heart failure. It has a negative inotropic properties. Basically, what you need to know is that we wouldn't prescribe this for a heart failure patient. Has many drug interactions because it is a potent inhibitor of metabolizing enzymes in the liver. So please make sure you review this class in your text and just go over and know what some of those drug interactions are. Okay, I am moving on to slide number 43. We are still talking about systemic antifungal agents. And we're on slide 43. The next drug in this class is Lamisil. It inhibits squalene. I'm trying to figure out how to pronounce this word. Squalene expedase, a key enzyme required for biosynthesis in fungi. It's used for onychosis of the toenail and fingernails. Serious adverse effects: pruritus, itching, which is itching, rash, fever, chills, nephrotoxicity, hepatotoxicity, neutropenia, and lymphopenia. Okay? So make sure you look at that one as well. I am moving on to slide 45 because 44 is the question. And okay, so now we're going to change drug class. Before we was talking about systemic antifungals, right? Now we're going to talk about antiviral agents. So these are medications that treat viral infections. So the first med in this class is Zofarax. It inhibits viral cell replication. So it inhibits the virus from multiplying or replicating. It's used topically to treat herpes genitalia, talus, orally used to treat recurrent genital herpes, IV to treat herpes simplex type 1 and 2 in immunosuppressed patients. Our serious adverse effects with this one is pruritus, rash, burning, burning hives, diaphoresis, nephrotoxicity, hypotension, and confusion. Caution with topical use to avoid spread. So basically what they're saying is when you're educating your patients, you want to teach your patients to be cautious when they're using topicals. They're only applying it to the area of which it applies. They need to wash their hands, because if they don't wash their hands after they do this area could still be contagious, and now they can touch their mouth or their genital, and now there's a possibility of it being spread. So that's what they mean, use caution with the topicals and to avoid spread. So you want to inform your patients to make sure they're doing proper hand washing before and after applying this, if it's in a topical form. Okay, I am moving on to slide 46. So we're still talking about antiviral agents. This is Fambear. The action is it's a prodrug of penicillin, which inhibits viral cell replication. It's used to treat recurrent infections of genital herpes, acute herpes zoster. Common adverse effects is nausea, vomiting, and headache. Serious adverse effect is confusion. So this is another one of those that's in that viral family to treat herpes. This is when adults get shingles. You'll see all these kind of particular medications. Okay, I am moving on to slide 47, and we're still talking about antiviral agents. Tamiflu, it inhibits the neuraminidase. It's used to treat uncomplicated acute illness caused by influenza. So Tamiflu is one you'll see if a patient call in a reasonable amount of time. This is the medication doc might order to help get the flu symptoms and things like that under control. Common adverse effects with this class is nausea, vomiting, cough, sore throat, fever, and continuing symptoms. Okay, so just because the patient is taking this, they may start to feel better, but it may not alleviate all the symptoms. It may just minimize the symptoms so that it's tolerable, so they don't feel as bad. Okay, but Tamiflu is given when people get the flu. Long story short. I am going to move on to slide 48. Okay, so we are still talking about antiviral agents. So with these drugs, this ribavirin and the drugs related to it, the action is unknown. It is used in combination with interferon alpha-2b to treat chronic hepatitis C, effective against DNA type viral families, inhibitory activity against RSV. RSV is something you'll see more in your pediatric patients, and some older adults can get it as well. Influenza and parainfluenza. So the common adverse effects with these meds are rash, conjunctivitis. Serious adverse effects is diminishing pulmonary function. That's huge, because that's a serious adverse effect that you don't see with a lot of meds. So These meds can cause diminishing pulmonary function. So if your doctor is running pulmonary function tests because your patient has asthma, it can disrupt some of these pulmonary functions, right? And anemia. So when you're doing a CBC or they're checking if a patient is anemic, these might make the symptoms worse, and they can become serious adverse effects, okay? Special techniques for monitoring and administering breathing treatments, because this Virazole is an aerosol form. The Ribitol is an oral capsule and suspension form, and the Ribsavir is a oral tablet and capsule. So just be mindful, look those over. Again, what are you going to teach your patients? Because with these medications, patient education is huge. So I'm going to go on to slide 49. Slide 49, we're still talking about antiviral agents. Valtrex. Valtrex is another one that's used to treat herpes of some form. It inhibits viral cell replication. It treats acute herpes zoster, which is shingles. So you might see this if you're taking care of an elderly person and they have shingles, and herpes labialis, cold sores, and genital herpes. So the therapeutic outcomes with these is the elimination of the symptoms of the viral infection, because the symptoms are very painful. These blisters that happen, they burn, they itch, they sting, they're very uncomfortable. So that's the stuff that you want to be aware of as far as, again, when you go to educate your patient who's taking these medications. All right. Slide number 50. This is the last of the antiviral agents. And this is zanamivir. The action of this med is it inhibits neuraminidase, an enzyme on the viral cell coat necessary for replication. So it's going to disrupt the replication, which means that if it can't replicate, then we're going to get it under control, right? It's used in uncomplicated acute illnesses from influenza. Serious adverse effects is asthma, bronchospasm, diminishing pulmonary function, because see, you got severe adverse effects, and asthma is pulmonary, bronchospasm is this pulmonary. It's going to diminish the pulmonary function. A patient might also, under serious adverse effects, get a cough, sore throat, a fever, and the symptoms may continue, okay? And I am going to slide 2051, and that is our question slides, and that is going to conclude chapter 45, which was drugs used to treat infections. Please go over this. If you go over the tail end of where we left off and you have any questions, please shoot me an email or bring it to my attention next week. I'll clarify anything you want to know. This one is a big chapter. It's a lot of medications in there to treat viral infections. Again, to simplify them, break them down by drug class, because again, in the actual class, a lot of the common adverse and the serious adverse effects are going to be the same. You want to highlight out the ones that are different associated with that drug. So go on, put that together. I will be sending this out. Oh, you'll get it. I'll send it in the announcement. I was going to let y'all know I'm sending it out later, but I'll explain to y'all in class. I have to send these when I get home because it's not good reception here for me to send them out here. All right, Pharm Scholars, I look forward to seeing y'all on Monday morning. Take care. I hope everybody have a restful weekend. As much as you can, study, and study some more. All right, see y'all on Monday.